Good afternoon, everyone. This is Dr. Merkle with Back to Health, your guide to better living. And we have your guide to better living. That's my radio show handle. And we're going to start with we're going to be talking about urinary chelation and testing protocols. We have Dr. Brimhall with us today, and he's going to be joining us after my presentation here. And we're going to go right into it. This is going to be hopefully the fastest hour for learning. And again, I am Dr. Merkle. I'm in Dayton, Ohio. And there we go. And we're going to show you how to use DMSA for a urine challenge. And we're going to give you some treatment guidelines too, but let's get right into it and show you how I do it. I've been in practice over 30 years, and I've been doing oral chelation for at least probably 12 years, maybe 15 years. So why do chelation? First of all, I want to go over just some things and my philosophy and the way we do things. Chelation is not used to treat autism, MS, lupus, Parkinson's, or anything else. All chelation does is assist in the elimination of toxic heavy metals. You must still work to restore proper diet, nutrition, minerals, vitamins, and digestion, organ system function, etc., which the body needs for healing and repair, restoration, maintenance, and optimal function. And I think this is where people get in trouble with chelation. They think just doing chelation is enough. It is just the tip of the iceberg. You've got to do everything else to really help these people. Why do chelation? To prove that there are toxic elements that are not coming out through hair or regular urine. And I'll show you some cases of that here a little bit later. And it's also used to show that chelating agents work. Now that's very important. Some people talk to us, well, why do we need to do the pre-test as well as the challenge? To show what is coming out without a chelating agent, and then to be able to show that with the chelating agent you get increased elimination of toxic elements. That's the purpose of what we're doing. Now just a little review of what all these toxic elements, well, actually, how to eliminate these toxic elements. And we're going to focus on DMSA, which is what we're talking about today. DMPS is by injection, although I did hear that there's one company that has it orally, but I am not familiar with that. DMSA is the one that you use for the challenge. There are many other things that you can use for treatment, but our focus today is how to do the challenge. So what is DMSA? Well, that's the molecular structure of it, as it's chelating an atom of mercury. And here's more about DMSA. And if you want to study more about the technical aspect, chemical aspect, you're welcome to do that. But I want to get into the main function of how to do it. Here's a very important part here. The DMSA can cross the blood-brain barrier. And it's one of the few that actually do cross the blood-brain barrier. And we've got some great cases where we've seen some dramatic results because of this ability to extract heavy metals from the brain pretty effectively. Now there is DMPS. IV or oral is the most productive agent for provoking the challenge. Although we don't use DMPS, it is absorbed maybe a little better, and maybe that's why doctors use DMPS. One of the problems with DMPS is there are a lot more potential side effects from DMPS, especially when you inject anything into the body. There's always a risk of problems, whether you inject DMPS, DMSA, EDTA, always higher risk. But with the vitamin companies developing formulas that are so easily absorbed, in my opinion, I don't think we need to even consider IV chelation because the oral chelators work so well, and other products which Dr. Brimhall will be presenting a little bit later on. So the lead-lowering effect is also well documented using oral EDTA, and EDTA is mostly known for its ability to eliminate lead. As you can see from this again, your DMSA has a little more functionality and is able to eliminate more things than just EDTA. But one point I want to make here if you just use EDTA and you are lowering the whole body burden of lead, that's still going to leave the rest of your body able to better handle mercury or other things if for some reason you don't use DMSA. But then you're going to test with DMSA. So what does the FDA say? Turns out they have only one approved substance that's scientifically proven chelating agent, and that's DMSA. DMSA was approved as being safe and beneficial for use in children to remove lead. It also removes 20 other toxic heavy metals without removing any beneficial minerals. And it also chelates substances. Foreign chemicals are also foreign to the body. Initial testing. Now, this is exactly what you're going to do for your patients, or at least what I do for my patients. The first time you ever test a patient, you'll need a pre- and post-test kit. In the pre-test is where you're just going to collect 6 hours of urine. That's it. Just regular 6-hour urine. No provoking agent. You just pick 6 hours and collect the urine. The post-test is you're going to take the DMSA all at once and then collect the next 6 hours of urine. So you're going to have a good comparison to see what was just being eliminated, and then after DMSA, you're going to see what comes out. And it's usually very dramatic. In fact, I've been doing this for years, and I've never been sorry I did it. I've always found some very good, interesting things. So to do the initial urinary challenge, you'll need 2 test kits and 1 bottle of DMSA. The cost? Okay. I'm sorry, I'm zipping through that a little too fast. I don't know if that downloaded to you.
There's a delay.
There's a little delay. Okay. Now, the cost to do the testing is going to be, we have discounted pricing, and for SBN members, the cost to do testing is $60. And this is through Doctors Data, which is the largest company that does these chelation challenges. And so you're going to need 2 of those test kits at $60. Now, you can charge $95, what we charge in our office. And so you're going to need a pre-test kit and a post-test kit. Now, what we do when we get these kits, we write on it pre and post. That way, when we manage it in the office, when we give it to the patient, and then when Doctor's Data gets it, it's pretty easy to see exactly where they're at. So, what's in the box? You got a collection cup, this guy right here, storage container, and there's requisition forms in there, and shipping supplies. And here it is all laid out. Now, this little thing here was that little expandable cup, expandable container that expands into this. Okay, and your shipping supplies. It's got everything you need right there. And we're going to go through that in detail. Now, you're going to prepare the test kit. Now, how do you determine, first of all, the common standard challenge and standard therapy dosage? Now, the standard dosage is based on the patient weight divided by 2.2 pounds per kilogram of body weight, and then you multiply that by 30 milligrams per kilogram. So if your weight is 150 pounds, the traditional standard recommendation would be for you to take 2,040 milligrams of DMSA all at one time, which is what I did when I first started doing this years ago. The problem was I was having people have side effects and problems, which I'll review those here in just a few minutes, and I didn't like that. But if you use the standard recognized challenge dose, this is what you would do. If you weigh 200 pounds, this is the dosage that you would do. 2,721 milligrams, or 2,700. 220 milligrams is going to be 2,900, and so on. And that's a very high dose. So what do? I changed it all and reduced the dosage where I never go above 2,000 milligrams a day. And for the patient who can't tolerate sulfur drugs, DMSA is not the same as a sulfa drug. And we have patients who can't tolerate sulfa drugs. They can do DMSA. But we still have them do what's called a test dose. The day before they do the challenge, we have them take 100 milligrams just to make sure they don't react to it. And rarely do they ever react to it. So we have them do, like the night before, 100 milligrams to see how they do. And then that next morning, they well, actually, I want to get back to the dosages here. Here's a dosage that you use: 100 to 110, 1,000 milligrams. 110 to 120, 1,100. You can easily see this is our challenge dose. And again, look at 200 pounds. You would be almost at 20. You'd be at 2,700 milligrams using the standard dose versus 2,000 versus what I recommend. So, like I said, you'll have far, far fewer, if any, complications or problems or patient complaints at this level versus standard dose. Also, look at the daily therapy dose. I've reduced that way down. The standard treatment dose would be the standard dose 3 times 3 days in a row. So you'd take that dose, if you're 200 pounds, 3 days in a row, and look at this versus mine. Now, I know this is standard, and this is to eliminate the toxic element very, very, very quickly. Now, I'm not in a big rush. I just want to eliminate it as safely as possible with the least amount of risk, and that's what we're doing with this. So the traditional model, give a large dose to see how much there was and how fast it could be reduced. The treatment doses were the same as the challenge dose to try to reduce or eliminate the toxic elements as quickly as possible. The SBN model, what I do is use a minimal or moderate amount of DMSA to determine if there are levels of toxic elements that are not being eliminated in hair or regular urine. And treatment using DMSA or other chelator is to increase the elimination of toxic elements, to reduce body burden of toxic elements, but do it in such a way that it's very mild with very low risk. Basically, we want to make sure it's coming out faster than it is going in. DMSA has a half-life of about 6 hours, so it's mostly out of the body in 4. If a patient has discomfort, reassure them that it will pass usually within 4 to 6 hours. Drink more water to flush it through the system, and take a little, and I'll recommend maybe 200 milligrams of magnesium and maybe 500 milligrams of calcium if they have a little discomfort, but generally it's out of the body within 4 to 6 hours. 4 to 6 hours. Now here's a requisition form. I know you may not be able to see that very well, but this is the pre-kit before any before any DMSA has been administered, even before that little 100 milligram challenge dose. Before anything's been done, DMSA, you collect just 6 hours of urine. And you're just going to fill out this form. You're going to fill out this form here. And it's got, well, anyway, physician account, and fill in all the basic information there. And right there, I know it's probably a little blurry on your screen, it says pre or post, and that's all you're going to do on that. Fill that out. Do not fill out any other information in the section, just that. Now, the pre-kit. You're going to fill out sections 1 and fill out only the patient name, the date of birth, the sex, and all those things right there. Do not fill out any of this information here. If you're in any state and you're going through SBN and using our account, unless you're from New Jersey, New York, or Rhode Island, but other than that, this is how you're going to do it. Now, if you are from New York, New Jersey, Rhode Island, here's how you're going to do it. And you must complete Section 5 if you're in these states. Please note, because there's no third-party pay, and you doctors from New York, New Jersey, and Rhode Island already know this, the patient's payment information, basically, do not fill it out, but they do need to put in the patient information for payment there. And this is where that they will either send a check or put in their credit card information to pay for the testing right here. Like I said, they're going to pay for the testing in New York, New Jersey, Rhode Island. That the patient has to pay themselves if they're from these states. If you're not from those states, don't worry about what I just said. So, now what you're going to do, here's your specimen vial, patient name, and date collected. And now, okay, let me go back and explain what you're going to do. Remember that big container? Now, there's a little cup, and I don't want to go all the way back, but there's a cup, and then there's a large container. Quite frankly, depending on your anatomy, you may not need that cup. But if you do need that cup, you're going to pour it into that larger container. Now, after you've got your 6 hours of urine collected, and you can put it in the refrigerator, After you got your 6 hours, you're going to shake that up and mix it up for several seconds to make sure that nothing has just make sure it's mixed up thoroughly, completely. And after you've mixed all that up thoroughly, you're going to fill this little vial up to this level. Fill it up to that level, put the lid on it, and that's all you're going to send in, that amount right there. Then, well, we're going to show you how to send it in here in just a minute. But now here's your post kit. Same type of thing, but now here you've got, well, actually the post kit, they've marked the wrong one here. But you would mark the post kit here, the post kit here. Now, actually what you also do is put your provoking agent. You'd put DMSA right here, and be sure and put the dosage that you put in right here, like 1,200 milligrams or 2,000, whatever you use. Put it right here, because that will show up on the report you get back from Science-Based Nutrition or doctor's data. So be sure that you put this on your on the provoking agent and the dosage. Okay, and that's what it says right here. Don't fill out any other information unless you're from New York or New Jersey. Okay. And now here's the requisition form. Again, fill out the same information like you did on the previous one. And again, here's New York, New Jersey, and Rhode Island. You do fill this out on the post kit to make sure the post kit gets paid for. And then again, on the post kit, you're going to shake it all up after you've collected 6 hours and fill it up to this level here. Make sure you put the date and the date collected. Now, you always want to do this one, the post, after you've done the pre. Don't do the DMSA first and then do the regular urine. You must do the baseline test first and the DMSA chelation challenge second. There'll be some residual thing, but anyway, always do it that way. Now, just a little point of fact, after you do one pre-challenge without using DMSA, you don't have to do that one anymore. When you retest that patient in 2 months, you don't have to do that one again. I think I'm getting ahead of myself here. Once the testing supplies are prepared, we like to take supplies into a consultation room to discuss testing explanations for our patients. We go over everything just like I told you with our patients. Before the patient leaves, explain the testing procedure. We've got everything written down for them in an easy-to-read format that explains what we just told you. And then we're going to give them the pre-kit, the post-kit, the DMSA, and the toxic urine challenge instructions right there. And then my staff pulls out each item as they explain the testing. So very easy to do. It's all right there for you. The urinary challenge instructions, day 1, using the pre-kit. First thing in the morning, patient urinates, but do not collect that specimen. Upon next urination, collect the specimen in the collection cup and pour it in a storage container. I know it's a little redundant. Keep the clear container refrigerated. After completing 6-hour collection, mix the urine by shaking it in the clear container for at least 30 seconds. Pour urine into the specimen vial all the way to the top, or actually to the little line there where they want you to do it. And make sure you've filled in all the information that you need. Place the vial in a Ziploc bag that comes with the kit. Place the bag in a cardboard shipping box that you got all the kit in. Store in the refrigerator until it's ready to be shipped. At the end of the 6-hour urine collection, take the trial dose of DMSA. The trial dose, that's the 1 tablet, 100 milligrams. And then first thing in the morning, there's a little cup. Depending on your anatomy, you use that. And then you're going to pour it into here for the full 6 hours. Keep it refrigerated. And then right there's a little test tube. Shake it up. Fill it here. Make sure you put the dates collected. Put in this little, there's a little sanitary napkin for you to use. You don't have to put it in a plastic bag, but you're going to put it in the plastic bag before you send it. And then you're going to put that in the pre-box. And you're going to send them separately, basically. And then put the box in a FedEx clinic pack. That comes in the box. And then you fill out your information, write your name and address, and the space provided on a billable stamp. Tear off the customer receipt for your records. affix the billable stamp to the clinical pack, keep refrigerated until it's picked up. Call FedEx, follow the prompts, tell the rep you need a pickup for a shipment using a prepaid billable stamp, and give the address location of the pickup. Do not use a drop box. Okay, end of day one. There's a 6-hour urine collection. The patient take the trial dose to test for sensitivities, and we'll talk about the products here in just a minute. The patient will also need to include payment in each test kit. All this for New Jersey, we already covered that. Urinary challenge, day 2, using the post kit. And again, empty the bladder, but do not collect the first urine after you've urinated. Do not eat before taking DMSA. Do not take any other supplements on this day, or at least for the first 6 hours where you're collecting that urine. Do not eat for 2 hours after taking DMSA. Next time the client urinates, they collect the specimen in the collection cup and pour it into the storage container. This is done for the next 6 hours. And basically when you do this, during the 6-hour collection, you need to start drinking water immediately. And I usually want people to drink a couple glasses of water, but you need to drink at least 1.5 liters of water. And you can use Aquafina or Dasani or good filtered water during the 6-hour. And try and drink it more in the beginning. And you can taper off. But I really try and get people to drink, a couple glasses right off the bat and try and get to 1.5 liters in within like 3 hours. And then after, we already talked about that, mix urine for 30 seconds, put urine specimen vial, and screw tap on securely. And just like the pre-kit is how you're going to process that. Now, into some cautions. Some patients will experience gas, fatigue, bloating, or diarrhea when taking the DMSA supplement. This is to be expected, is not cause for any alarm or alert, and other symptoms may occur. These symptoms are now very rare due to our new protocols using lower doses of DMSA. Also remember, again, that DMSA has a half-life of 6 hours, so it's mostly out of the system in 4 hours. And then patient must wait at least 7 days after taking DMSA supplements to have any blood drawn for a blood test. And we always remind the patient, do not dispose of your DMSA. You'll use it again at a later date. We will use the DMSA always for the challenges and retesting, but you might choose to use something else for the treatment. And there's the second post. You're just going to package it up and ship it just like the other one. And we give the patients 2 options. They can bring the boxes directly to our office during office hours, and we'll ship them, or they can ship them on their own using instructions included in the packages. You do not need the storage containers returned. We ask the clients to recycle these containers, rinse them out, and use them again if you want to. But actually, with the new kits that Dr. Zeta have, they send you, and it's all compressed, and it pulls out that nice big jug, so you don't really need to reuse them, but obviously recycle them when possible. Okay, toxic urine test results usually take 7 to 10 business days. They've got to be shipped up to Dr. Zeta, and they've got to do their thing. Determine therapeutic dose. Now, this is the treatment that you could do using DMSA therapy. Once we test, we know that it is effective. And for my practice, I will commonly use DMSA at least for the first 2 months. And then I might go to a different form. But I'll take 300 milligrams twice a day. And the standard way to treat, if you're going to use DMSA, is 3 days on, 11 days off. So 3 days in a row, you take the standard dose, or 600 milligrams a day for 3 days in a row. And that's what we generally do. 600 milligrams a day, 3 days in a row. And we usually recommend to take 300 milligrams a day, but really, even taking 600 milligrams a day all at one time is usually not an issue. So you do it for 3 days, and during those 3 days, you take DMSA and magnesium only. No other supplements. Take away from food. Be sure to drink plenty of water. Then your 11 days off of DMSA, you take all your regular supplements as recommended, and typically we go through 5 cycles and then retest, which will be just about 2 months, which is when we generally retest the blood work too. Retesting. Do not retest the blood work during a day the patient is taking DMSA wait 7 days after they finished a round of DMSA to retest the blood, and the DMSA, or we call it captomer, could temporarily raise or lower certain blood tests. So we want to make sure we do it away from that. You know, you always use the same dose of DMSA as the challenge dose, even if they lose weight. And you have to use DMSA for the post-challenge. If you use DMSA in the beginning, you got to use it at the end. And it's really the only standard that is shown to really be reliable for chelation challenges so far. And the therapy depends on patient tolerance, liver, kidney, and thyroid function. And basically, before even doing the challenge, you want to assess if you believe there is liver or kidney dysfunction, especially kidney, because DMSA is eliminated through the kidneys. So if they are having any signs in a dipstick urine, a urine test, if they're showing any protein or any signs of kidney problems, we will delay until we get a blood test to make sure that the bun and creatinine are not elevated. And if we suspect liver problems, we'll also delay until we see the blood test to see if there's elevated liver enzymes or hepatitis, some other things. And same if their thyroid is showing signs of inflammation, we may delay doing DMSA till we get some things under control. So we're going to look at mineral levels. If they're major anemia, we may delay doing DMSA till we got the anemia under control. And then we look at the test results. Was there a bigger purge or smaller purge after using DMSA? Keep in mind, there is no hurry. Slow progress is better than no progress, and that's why I have lowered the testing and treatment dosages down. And the testing will guide your recommendations. For the patients that get GI upset from the DMSA, then I'll use other chelating agents. Suppose during the challenge you get a little bloating or something like that, I'll use products like EDTA, which is a good chelator. And there's also products that have a combination of things like chlorella, spirulina, glutathione, and NAC, and acetylcysteine, which are also good treatment for therapy. And but the challenge still has to be done with DMSA. And sometimes I just tell patients, you'll just be a little uncomfortable for a couple hours, but rarely does that happen. Now, an important point here, DMPS, DMSA, and EDTA are eliminated through the kidneys and out the urine. So that's important for kidneys, but chlorella, spirulina, glutathione, NAC, and other formulations can eliminate through the stool, which is a very important point which will relieve stress off the kidneys if there's any kidney involvement. So we like to have things that spare the kidneys, but we can use long-term if they've had any kidney problems at all. So very important here on these other products. And actually, we rarely do have any problems now with the new lower doses we're using. People can do and tolerate DMSA quite well. DMSA works faster and more aggressively than anything else in any of the other chelators like EDTA, chlorella, cilantro, NAC, anything else. DMSA works the fastest. And we use it at least in the first initial weeks when people have serious problems like Parkinson's, lupus, MS, autoimmune disease, autism, things like that, to try and get the toxic elements down so that our nutrients can work. And DMSA, there it is. More water is helpful if there's any problems. There it is. Take 500 milligrams of calcium, 200 milligrams of magnesium if you tend to get symptoms, which again are rare. Sometimes you get muscle cramps, spasms, flu-like symptoms. And if you do get those, then we'll lower the treatment dose by half and increase the calcium, magnesium, and water accordingly. And if symptoms persist, we'll go to EDTA. Again, DMSA is still supposed to be used for a challenge, but if you have to use the EDTA, you're still overall lowering the total toxic burden on the body, and that's always good. Chelation in your practice, you can add another dimension in your practice, expand your abilities to more effectively take care of more people with various conditions. You'll be able to do it safely with the testing that we recommend. And there are many doctors and people doing chelation, even IV chelation, that do not do blood testing to make sure that there's no kidney or liver problems. They're not doing hair. They're not even doing urine challenge to know if they're creating a problem. You will be better, get better results if you test properly. And I can't tell you how important it is to test to show the patients that what you're doing is working. Now, I take DMSA nearly every Monday morning, 600 milligrams all at once. So even though I'm I'm healthy. I take a lot of vitamins. When I test myself, the challenge, I always have mercury, lead, aluminum, and arsenic because it's in our environment. If you live on this planet Earth, you've got exposure to toxic heavy metals. And what I want to make sure is that I'm reducing, and that what's going in is going out, and hopefully what's going out is faster, is more than what's going in. And less heavy metals is always good. So I do that every Monday, but I also do other, like EDTA and other things that Dr. Brimhall will mention on an ongoing basis. Now I've just got a couple case studies. Ankylosing spondylitis, 14-year-old was medically diagnosed. He had the HLA-B27. I'm going to go very quickly through this. Now he presented with a lot of lead pre-challenge. Nothing showed up on his pre-challenge. I don't have time to go to the hair, but pretty much the same way too. Nothing is coming out, and yet he's got extreme, by the way, blue is code blue, means very high. This is our SBN program here. Red is clinical. Anything red or blue is clinical, but blue's worse. Think blue, code blue. So it's extremely high levels of lead, but it's not coming out. We tested him again. We put him on a treatment dose. Oh, here, let me. Well, for some reason that is not coming. That is not showing like it's supposed to. Okay, my bad on that, but it shows it coming down very nicely. Well, I must have messed up on this slide there somewhere. Let me go to another one. Clinton, here's another case. Let me see if I got this one right. Lead mercury not coming out. There's their chelation. There's high levels of lead and mercury. Subsequent tests, see how the lead's going down. Now the mercury is down to normal. The lead goes up a little bit, and this will happen normally. You'll see a high lead go down, then the mercury go down, and sometimes they'll dance around a little bit, but overall they're going in the right direction. And we see that going down further and further. Now the mercury's down to yellow. So very nice results. Peggy, again, let's see if I got this one right. Extreme high levels of lead and mercury. Extreme high levels of lead and mercury. Then with subsequent testing, look how much that reduced in just 3 months. 35 to 16, very nice results. This lady had chronic fatigue, and Dr. Brimhall is going to have this presentation on his site so you can review it again and see what she presented with. Here's a fellow with Parkinson's, and I've got the whole thing here that you'll be able to go through. And it's a fascinating case, and I'm kind of going through it slowly so you can kind of review it, so you can review it slower at your own time. But here's his hair test, and not much is coming out, which is very common. When you got somebody with these autoimmune disease, Parkinson's, autism, Alzheimer's, and things like that, the more serious problems patients have, they show almost no heavy metals coming out. But notice he's got a lot, everything's low. So you got to have these minerals to eliminate these. The body just can't eliminate lead. It's got to attach it to calcium EDTA. It's got to attach it to a mineral for it to be eliminated through the hair. So when you see this on somebody with Parkinson's, nothing coming out in the hair, they're almost always low in minerals. Now, we go through the chelation, nothing is coming out in the urine. He's not peeing anything out. But when we used a little 500 milligrams, that is a very low dose. He normally would have been, because he's about my weight, he should have been about 1,800 milligrams of DMSA for a standard dose, but because he had Parkinson's so bad, we used just 500 milligrams, and look, imagine how much that would have been if we'd have used the full, it would have been triple this number. So multiply that out, he'd had potentially three times that much lead coming out with a full dose of DMSA. And so extreme high levels of lead that's not coming out the hair and urine. So can higher levels of lead and mercury cause Parkinson's, as well as a boatload of other things? And look how much it dropped in just about 3 months. From 30 down to that. We used the same dosage of DMSA. You know he's better. We could have gone up, but we wanted to keep things so we could do a good comparison. So very nice. And after 4 months, 40% improved. Actually, he was no longer shaking. He got to jogging again, where before he could hardly walk. Now he was, after 4 months, he was back to walking, back to preaching. Amazing, phenomenal results. In fact, just taking the challenge with DMSA at only 500 milligrams, all of his symptoms of Parkinson's stopped. He thought we'd cured Parkinson's with that, but no, we just reduced the extreme high levels of lead in his body. Oh, and by the way, his thyroid got working better too after we got some of these toxic elements and things out of the system. Now, and well, anyway, there's more testing, but basically, you notice one thing I didn't show you? I didn't show you the vitamins we put him on. The vitamins are based on the lab test. And so, and that's another, that's what Dr. Brimhall can help you with is the vitamins based on the lab testing and things like that. I just want to show you the benefits of testing is to remove and reduce heavy metals, takes a burden off the system. And the idea is that allows the body to use its resources for more important functions rather than just deal with the heavy metals. So, now, the discounted pricing we have is available to SBN members only. And we have, I'd say, deeply discounted prices, steeply discounted prices for LabCorp and Quest. And we have also discounted prices cheaper than you can get on your own through Doctor's Data. And these are some of the things that we provide for our SBN members. And the discounted price for DMSA is $29. Now, there's some companies that used to sell it, and the price for the same amount of DMSA for other competing companies was closer to $50. But because it was so expensive, I've gone and found sources myself. And as an SBN member, you also get customer support, clinical support, and you also get a patented reporting system, which makes it easy to do nutrition for doctors and patients. You get an easy-to-read report that's color-coded red, yellow, and blue. And you'll be able to go to the Brimhall website to see a sample report. And if you want to become an SBN member, here's a quick enrollment form. All you have to do is fill that out. Now, Dr. Brimhall kind of twisted my arm. I gave him, and I'm giving Brimhall members a discounted rate of $3.99. And it is truly cheaper than anywhere else you can get it right now. And enrollment fee, that's the enrollment fee. You fill it out and send it back to us. And then, well, anyway, there's more details to it. You get 3 months free. And then after that, there's an additional $79 a month, which includes turning reports. But that's all I wanted to get through. Now, a little bit about DMSA. DMSA has been pulled off the, most all vitamin companies no longer carry it. And even the ones that used to be well known to carry DMSA no longer carry it. We are the only source of DMSA that I am honestly aware of right now. And and we are having, we only service doctors or members who are members of SBN. So I'm going to bring Dr. Brimhall on board now. And there we got Dr. Brimhall. We're going to turn it over to you. And let me see, make sure I've got you on audio here. Okay, there, Dr. Brimhall.
Can you hear me?
We can hear you. Be sure and speak up a little bit louder there. And I'm going, and everybody, this is Dr. Brimhall, and you are going to be seeing his presentation now. And I'd like to thank Dr. Brimhall for allowing me this time to speak to his members. Dr. Brimhall, it's all yours.
All right. Can you hear me loud and clear?
Yes, we can. Trace can hear you well, loud and clear.
All right. Do you have any questions? You can go ahead and shoot a question mark on there. If I can't hear it, then Dr. Merkle and his bride will be watching for us. This has been really a fun alliance for me to hook up with Dr. Merkle. I have used multiple other programs out there. They're all good. But definitely his program is the goodest. I know it's not good English, but it certainly kind of describes what we have. And what I want to tie into here is the fact that Dr. Merkle and I are DCs. And DC may think it means Doctor of Chiropractic, but it doesn't mean Doctor of Cause. And we're constantly seeking the cause of dysfunction and restoring normal function of the body. As he started off saying, we don't treat disease. Most of the time, we don't even treat dyshyphanes. Although patients come in with a problem of pain, we want to go back to the root cause, Doctor of Cause, Doctor of Chiropractic. And many of you with different degrees still can apply that cause. We have found there's 6 causations in the world out there: structure, electrical pollution, nutritional interferences, allergies and sensitivities, emotional stressors, and toxins. And we're really concentrating on the toxic aspect here today because it is so prevalent. It's just, if you're not understanding that, you're not helping your patients to the greater level. I've been in practice. I'm a lot older than Dr. Merkle. I've been in practice for 43 years next month. I also turned 67 next month, but I'm 67 years young, definitely not 67 years old, because I do all the things that we're talking about on here. But let me give you just a few statistics of why what he told us is so critical. He's the master of the testing, and we are the masters of understanding why we need to test and the treatment above and beyond just the nutrition, the structural, electromagnetic pollution, etc. We have 6 steps that we treat every patient for. Right, Dave, let's concentrate today on how many toxins and drugs, because it's not a big deal. Why are we even worrying about it? The problem is it's such a big deal. If you're not treating this, your patients are not getting well. They're just not in this day and age. When I went into practice in 1971, the chiropractor, one of them sent me to school, had been in practice for 50 years. And he even told me then in 1971, he said, when I first went into practice, he treated BJ treated him. He said, we just adjusted people, and they got better. I don't care if they're racehorses or chickens or dogs or people, they got better. He said, now I have to talk to them about nutrition and diet and exercise because people are degenerating, and we're going back 43 years. So imagine the last 43 years we should have been getting healthier, but we're not. We're getting sicker and sicker. We're spending more every day and getting less results, and a lot is due that we're not evaluating and treating the toxins and eliminating them from the body. Dr. Hyman, a world-famous MD, a very astute person in this area, said in the studies that he has seen, 287 drugs and toxins were found in the umbilical cords alone of babies. Now, I was told when I first went to chiropractic school, babies are born healthy and they get sick later on. In this day and age, it's not that way. Everybody is literally born sick, the way it's going. I have treated so many babies with failure to thrive syndrome, with all kinds of problems. I've been getting emails from a mother today with her child with Down syndrome. Will this help? Here's the issue. If you tune your car up, change the tires, grease it up, give it a wash job, whatever you can do to make that car better, is it not better? It is. Same with a human being. If you detoxify, if you get proper nutrition, if you adjust them, if you do craniosacral, you do visceral manipulation, you help them release stress in their life, does that help them? Of course it does. And the more complicated a patient is, the more of those things you have to do. But Dr. Merkle and I both believe detoxification is the foundation of testing. He teaches blood, he teaches hair, he teaches urine challenge, the same as I have for many, many years. And independently, I come from a world of applied kinesiology. He comes from a world from hard research and data. We both found if you don't detoxify, they don't get better no matter what else you do. They will resubluxate. They will not hold their adjustments. They will not get over Parkinson's or whatever named and blamed disease you want to come up with. But if you start off with detoxification, basically the body gets better because you've cleaned up the major problems. And right now, it has been documented there's 20,000 industrial facilities in the United States alone that's releasing chemicals every single day. Over 4 billion pounds of toxic chemicals are released by industry into our nation's environment. 72 million pounds of recognized carcinogens. And you say, why? Well, I'm not going to get into that. I don't know what to tell you. You would think that we wouldn't have to argue about that it would automatically know that somebody would help us clean that up. Dr. Merkle, for some reason, I'm not able to change screens right now. It was perfectly, and now it's not. Do you have any idea why that just happened to me? I was changing very perfectly, and all of a sudden it quit.
Dr. Brimhall, this is Tracy. You need to click on your screen with your mouse.
Okay, there we go.
Now.
All right, that's what happened. All righty. We clicked on the screen and we're mousing around here. Thank you so much. Dr. Merkle and I both married above ourselves. Our brides are much smarter than both of us. I'm sure he'll agree with that, so it's good they're around to help us out. Here's some other studies that were done. They did $13,000 per child, and the www.ewg.org, you can look at that research. Also, Mount Sinai does a 220 chemicals study for children. It costs $4,900. Dr. Gary Gordner introduced me to that, said he quit doing it because every single child had neurotoxins, endocrine disruptors, and carcinogens, every single one of them. So he just quit doing it and knowing that he needs to detoxify. And you say, how can this be happening? Well, this is a slide that was put together for us by High Tech Health. They They furnish me with the infrared saunas that I use, and Sarah, who works for that company, is just incredible for putting the research together, and I really appreciate her. But urban areas, waste plants, industrial, mining, agricultural, you just pick a number. We are having stuff dumped in our oceans, dumped in our water, heavy metals, sediment, toxins of all kinds are coming in, and there's just no way to escape that. We are all toxic. Doc said he treats himself every Monday morning for that. Well, I use Chelation to treat myself every day for heavy metals and also homeopathics, what we'll talk about. And you say, well, what's the big deal? Well, the big deal is these are the kind of symptoms you can have from heavy metals alone. Forget anything else. Forget all the other chemicals that we deal with, the halogens and the bisphenols, just chronic fatigue, fibromyalgia. This can come from heavy metals alone. And if you do the research on the heavy metals, you will see, according to every heavy metal, the research has been done, they list a whole list of symptoms, emotional symptoms, physical symptoms, conditions that have been diagnosed from that. So please, let's take a look at this and let's start making a change. Well, what part of the body is affected? And the answer is what part is not affected, from the joints to the testosterone. In fact, infertility, when I was young in practice, I hardly ever had anybody talk to me about infertility. Once, maybe 1 in 100 cases, people that were talking about not being able to have sex properly were 70 and 80 years old. Now we have patients come in 20s and 30s that can't get pregnant, men with erectile dysfunction in their 20s and 30s. And I will guarantee you the majority of this, from what I have seen in my 43 years of practice, comes from toxic accumulation. This is why I became so interested in it. And again, independently, Dr. Merkle came up with the same ideas and concepts that the foundation of health needs to be detoxified to allow the adjustment to hold and the nutrition to work better, etc. So that's what we do. Again, just to recapitulate what we talked about, these poisons are coming at us from every level. They're affecting every part of the body, every part of the body. So this gives you a view of the skull and crossbones that we're living in this day and age. Let's just take an example, because lead, mercury shows up with DMSA challenges a great deal, as it does in EDTA. So if you have elevated levels of blood, the lead ion diffuses across the blood-brain barrier. We're saying, well, DMSA is good because it passes the blood-brain barrier. Alpha-lipoic acid is great. It helps to detoxify across the blood-brain barrier. But if you're continuing to be made toxic through lead, and if you're as old as I am, then you were raised with leaded gas. You were raised watching parts out of your cars as you worked on your own car or vehicle with leaded gas. In my early practice, I had mechanics who were deathly ill, and they were spending every penny they had to try to get better, and they were giving them all kinds of drugs and treating them for the symptomatic expression. Nobody knew about detoxifying the lead. This is one of the things that led me to the homeopathic preparations we'll show you. We have homeopathics that are what we call a homochord. They're multiple tier layers where if there's lead in the body, you give them this, and the body chooses the layer that it wants in that homeopathic and triggers lead out of the body, or mercury, or arsenic, or cadmium, or uranium. It's just an amazing adjunct to what we're talking with the DMSA challenge. So let's just look at the cellular effects of lead. Hormone activates the G protein. G protein opens the calcium channels and causes release of calcium from the endoplasmic reticulum. Well, right there tells you we're in trouble. Lead enters through the calcium channel and binds calmodium. Inflammation, metabolism problems, apoptosis is thrown off, muscle concentration and contraction. Intracellular movement is a problem. Nerve growth is a problem. Immune responses are inappropriately stimulated. I think that's what they call autoimmune conditions, where your body literally starts to attack itself. Let's over to neurological effects. Lead disrupts communication between the astrocytes and endothelial cells. That's pretty spooky. Plasma moves into interstitial spaces, increased intracranial pressure, edema, as swelling of the brain, disease of the brain, irreversible brain damage happens from lead only. So the DMSA, the EDTA, the homeopathic lead all help to trigger that release. Let's look at how mercury. Mercury, if you've seen, you can type mercury on the YouTube and look at, there's actually a video that was shot showing how they put a little mercury in and watch it eat the neurons up. The actin, the tubulin go into trouble, neurofibrils degenerate. Literally the neuron just disintegrates, and it shows you how this happens with mercury in through here. So not only is it affects you, it also affects your unborn. We used to think that the placenta and the umbilical cord and all this was protecting the infant. We find that is not true. Unfortunately, the cancer clinics for infants is growing and growing and growing. If you're using mercury from the amalgams coming out of your mouth, you're cycling that every day. If you have fluorine on your toothpaste, you're cycling that into the body every day. There's no way I recommend having either of those anywhere around us. But again, I'm of the age where if you had a cavity, they put mercury fillings in there and told us it was fine. Now, the interesting part about government is once you took that mercury out of the filling, the dentist had to pay huge amounts to get rid of that mercury because now it was a toxic, neurotoxic substance. But when it was in the mouth, it was supposed to be safe. Pretty incredible. How about cadmium? Cadmium affects the respiratory system. So again, inflammation in the lungs. It causes destruction of the mucous membrane. In the reproductive system, testicular necrosis. That doesn't sound very good from my point of view. Estrogen-like effects for the male, increases the aromatase enzyme, converts your testosterone into estrogen. It also acts like a steroid hormone. Kidney, proteinuria, kidney stones, glomerular problems, tubular damage. Now, it's very interesting as we treat somebody, and Dr. Merkle is not a real fan of kinesiology, but I was raised in that world. I followed Dr. Goodhart around since 1968, and we found comparing kinesiology to proper testing, blood, hair, and urine, they correlate incredibly well, and you can measure dosages, and you can pick up that the kidney is in trouble. But his complaint to that is if you just find a muscle test and the kidney is weak and you don't know how weak it is, you're not doing the blood test, you're not finding out if they have heavy metals in there, you're not getting rid of the heavy metals and balancing the blood, then you're allowing potentially a disease process to start because you did not do your job. Well, when we find with kinesiology, hey, the kidney may be dropped, I may need to live it in place. The kidney may have an infection, I may need to give nutrition like Max Viral, Max Immune. I may want to put them on Max Kidney and rebuild the kidney tissue. And we have documentation and thousands of clinical studies that show as I get rid of the cadmium, I lift the kidney back into place, I percuss it to put it back into motion, I put them on Max Kidney, I start getting rid of proteinuria. I've had patients that have come off of dialysis, not because we took them off, they didn't need it anymore. All of a sudden their glomerular filtration rate went back up into normal ranges. So we want to do everything right, structural, nutritional, emotional, and the emotion tied into kidney is fear. So we might evaluate that with a 5-minute phobia cure, with feelings buried alive, never die. Different ways of approaching the same thing. But no matter what else I do, if I don't get the cadmium out, I'm going to continue to have degeneration of the kidney. It also affects our skeletal area. So it literally demineralizes the bone. And we could go on and on and on, but let's just take these few we've talked about here and go back to why we're having this. This heavy metal, arsenic, lead, cadmium, are coming in through our groundwater. Actually, arsenic is a mineral ore, and it's not destroyed in the environment. No matter, once it's been released and dug out of the ground or is available, it doesn't go away. You can change its whether it's liquid air or airborne or solid, but it never goes away. So we are being poisoned by this all the time. Arsenic causes all this: nerve damage, skin damage, increased cancer risk in the lung, bladder, kidney, and liver. Lead poisoning causes mental retardation, comas, convulsions, reduced IQ. That may be a problem in Washington, I'm not sure. We should check them for lead. Impaired growth, reading and learning disabilities, etc. So you can see why I am such a fanatic on this and why Dr. Merkle has done so much research to present to us of how to identify it and how to trigger its release. In 2009, the fourth National Report of Human Exposure to Environmental Chemicals was released, and it said 75 new chemicals were measured for the first time in the U.S. All these years, they're still dumping more new chemicals on top of it. In fact, there's new legislation where they don't even have to say what they're dumping into us now. So big industry has got to our politicians and allow it where we don't even know what's being dumped out there anymore. The chemicals are in following groups. All the different areas of arsenic and perchlorates. And here's interesting, when you look at perfluorinated chemicals and polybrominated diphenyl esters, look at this. These are the fluorine, the chlorines, and the bromines I'm talking about, and that's why we made homeopathic detoxification of these areas too. And then we give them iodine to help rebuild that up with selenium and molybdenum to help knock this stuff out and rebuild the tissue. Because every cell in the body has to have iodine. Every single cell in the body all day long. And yet the fluorines, the chlorines, and the bromines are knocking it out, and they're replacing our T3s, our T4s, etc. with fluorine and bromine. And when you try to take iodine, a lot of times you feel sick because it's trying to displace these. So we've made homeopathic fluorine, chlorine, and bromines to get rid of that, trigger the release in the body while you reestablish the good iodine back into the system. So if you haven't seen me demonstrate that, get to a seminar. Let me demonstrate that for you. I've also done puzzle pieces on it. I've done other webinars available through brimhall.com, www.brimhall.com, real simple, and you can get some of the webinars that we have. Additional chemical groups are already shown if they're not measured before. There's air pollutants. 187 hazardous air pollutants have been identified by our own government. Chemicals, pesticides, phthalates, DDT, hydrofluoric acids, chlorine, compounds such as methyl alcohol. Medications are, in fact, and other poisons are clogging up our bodies as well as our environment. Heavy metals that we've talked about there. And I pulled this right off of Wikipedia. You may want to go in there and look at some of that yourself. Dioxins, they are everywhere. They're environmental pollutants, contaminants in pesticides, herbicides. They're in air, water, meat, fish, everywhere. When they burn things from incineration, electrical fire, and wood smoke, these dioxins are coming out. More than 90% of human exposure is through food. It is in dairy products, fish products, shellfish, and particularly when you're talking about pesticides, defoliants, the body cannot tolerate this. And yes, we're just loading our system up with it. And there's another area of the reproductive problems and genetic damage. Hydrazine, sources, food additives, photographic supplies, herbicides, pesticides, textiles, drugs, plastics. Gosh, I wonder if any of us have been introduced to any of those today or yesterday or the day before. Acute effects can be cough and irritation of throat and lung, convulsions, tremors, and seizures. Chronic effects, the damage of the organs that we're talking about. So we're picking these up in our environment constantly, every single day. Now the key is the brain is plastic. We do have the ability to rebuild and repair, but we have to detoxify it first. So these are the homeopathics that I made that are supplied through Zymogen Bioenergex. Bioenergex is the brand that I have formulated for Zymogen. They're the manufacturers. They have a new $13 million facility, and I think no company can come close to the purity of manufacturing that they have available. Even the drug company, there's only two that can come even close, much less any nutraceutical company. But these have worked incredibly well. This is my second generation of them, and we make them in different tiers, so whatever your body needs, it can pick this up and trigger the release of aluminum out of the body, or lead, or mercury. We have one for the major metals in the body. Another substance that I use every day is Chelation. This is made by Zymogen, and this has the ability to go and trigger the release of many different toxins and heavy metals for the body. The reason is the number one ingredient is DMSA. Now they're doing some research to see if they can replace the DMSA with other nutrients just in case the FDA does take it off the market. It's so effective, it's pretty scary. When something works really well and is very inexpensive and you can save lives, it seems like it gets taken off. So at this stage of the game, a 4-capsule dose does 100 milligrams. It also has DEDTA in it, and oral EDTA is very effective. A lot of research on this. I have written articles on that and also done puzzle pieces on that. It contains cilantro, chlorella, allicin from organic garlic, and acetylcysteine and alpha-lipoic acid, all in one product. And Dr. Merkle alluded to that. You can do those individually, but we have put this in one product here that you should use on a daily basis, at least a minimum of 1 capsule a day. How long? Well, as long as you're on planet Earth. And it would be good to do some detoxes with it. We teach how to do that in our seminars. But basically, when we find homeopathic metals that need to be used, let's say I find lead or mercury, I would give the homeopathic lead, I would give the homeopathic mercury. I'm also always going to give at least 1 to 3 capsules a day of Chelation to pull the other metals that come out. Now, Dr. Merkle pointed out to you, and I hope you really caught the vision there, on the first test that he would show you on the urine, almost nothing came out of the urine, time and time and time again on every patient he saw. Maybe 1 small amount of lead or small amount of mercury, maybe 0. As soon as you do the challenge with DMSA or even with like Chelation, if you use enough of it, you retest, large amounts of lead, mercury are coming out in the urine. On hair analysis, he also mentioned sometimes you don't have very many toxic metals coming out in the hair. Then you do the challenge, all of a sudden all kinds of toxic metals come out in the hair. And in fact, when you start doing the treatment, your hair analysis, your second hair analysis may be worse from higher metals coming out in the hair than before, which is good. Same as the urine was worse because now you gave something to release those toxins from the cells. And our opinion and our experience has been in both of our practices, me as an applied kinesiologist using blood tests and hair and blood, and his from a guy that has more initials behind his name than almost the alphabet, doing testing, lab testing, same conclusion. Get rid of the heavy metals, get rid of the toxins, the chlorines, the fluorines, the bromines, and then put the good trace minerals back and the good nutrients. Support the kidneys with Max Kidney. Support the liver with Max Liver Detox. Support the brain with Max Brain. It's real easy with the products that I formulated for Zymergen under the BioReject formula because they start off with Max. You want to treat the brain, Max Brain. You want to treat the kidneys, Max Kidney. You want to treat the lung, Max Lung. So it makes it real easy. I'm not real smart, but I'm very persistent. So I've been researching this stuff for all my 43 years in practice. I find out what works, and then I name it with something I can remember. I want to treat the brain. Why don't we call it Max Brain, Max Kidney, Max Liver, etc. So this is an incredible product. They're working on improvements even now. It's something we recommend all the time. When we check somebody, and let's say if you are a kinesiologist, you have learned in the past when you go to therapy localized or find an area of the brain that's under stress and you want to work on it, it doesn't show up. 99% of the time the brain will not show. I couldn't understand that until I developed the homeopathic formulas for metals and the toxic halogens, chlorine, fluorine, bromine, arsenic, lead, cadmium, uranium, thallium. Now when I find out which heavy metal or toxic halogen they have, give them 1, 2, 3 drops in their mouth, all of a sudden the area of the brain that's in trouble shows up. So we support it nutritionally with Max Brain, with alpha-lipoic acid. We use Lipocol because Lipocol has a krill oil. It's a special processing of krill oil, and like one capsule, that's like 5 large capsules of fish oil. So I really love that. But you have to do the essential fatty acids, whether it's with flax or fish or krill, but Lipocol is my favorite for sure. And then we laser and we give supporting nutrition to these areas of the brain, and we see results immediately. I mean, it's just amazing. I mean, patients, we don't treat disease, but it's not our fault when it goes away. We've seen schizophrenics, we're no longer schizophrenic. We've seen bipolars, we're no longer bipolar. We've seen people with compulsive disorders that couldn't even leave the home with doing this and, you know, a week on the nutrition, they go out of the home and wonder why they were ever homebound. Those kind of things do happen because we're treating the causes, the foundation, getting rid of the toxins and rebuilding the area. The one reason we use nutrition is because it helps to rebuild the parenchymal unit of the body. The same reason we use laser. Laser is a parenchymal unit of energy, photon packets of energy. So when we laser into an area, it literally, we use red, infrared, violet, and you can call my office, 866-338-4883, or go to brimhall.com. And this laser is actually taking a drop. It was $3,500 just a couple months ago, go all the way down to $3,100. And so it's very inexpensive to start doing laser. Here's another one we use, the LZR7. This is 4,500 milliwatts. This guy here is 80 milliwatts, 40 of pure red, 40 of pure infrared, and it has 20 5 milliwatt violet LEDs, which are still very powerful. So we get 3 wavelengths. Here is one very powerful wavelength, the infrared, but it's 4,500 milliwatts. And it is still a cone laser. If you coned in that one small area, you could burn a patient. It would become a hot laser because you can see that we cause divergence of the different waves coming off of the diodes here. We can concentrate 4,500 milliwatts into your area that promotes incredible amount of healing. You measure the amount of healing into the tissues from a laser in joules. Well, every watt for 1 second, if you do 1 watt of laser for 1 second, that's 1 joule. So you're doing 4.5 joules per second. So in 1 second, 3, 4, 5 seconds, you're getting incredible amounts of healing power, but you're not burning the tissues because of the way this laser has been devised. So call my office. They can give you the skinny on that. I use one every day in my office when I'm treating. In fact, both those lasers that I showed you. The nutrition that we've developed, again, is called Max, and it's under the BioInjects label from Zymogen. So the hypothalamus pituitary, the major electrical communication of all the brain, the major glandular of all the brain, max brain, max female, max thyroid, max male, max adrenal, max deflam, all this speaks for itself. And when I'm evaluating a patient, once I detoxify them, I then start using the areas that specifically show up through the blood studies, through hair also paints a picture of which organs are under stress. I also use kinesiology and verify it. We never use one thing. We use as many things as we can: case history, physical exam, blood, hair, urine challenge, muscle testing, muscle response therapy, all of it. Alamax CR is a controlled release from Zymogen, which is an incredible product. The half-life of alpha-lipoic acid is like very rapid. I think it's like 22 minutes or something like that. You lose half of your ALA. So this is controlled release, so it continues, stays in the body up to 4 hours. This is for insulin sensitivity. This Chelation I already showed you. Lipocol is the krill oil. Minrex, because sometimes you will pull heavy metals out while you're doing things like the foot baths, like the heavy metal challenge, so we make sure we have the proper trace minerals available. And I highly recommend you look at a far infrared sauna. The only one I use, I've tried other ones, but I go to High Tech. This is their number. Mention my name. There's actually a $500 discount if you purchase this. I have one identical to this right downstairs, and I try to get in a couple times a week. A little harder with 3-year-old twins when you're 66, but I get in there at least once a week, sometimes twice, and I use a foot bath at the same time. But infrared sauna literally dumps the toxins out of the fat cells through your sweat. When you normally sweat, you dump about 2% toxins. When you heat the cell from the inside out, you dump 15% toxins. So we're giving them the Chelation, we're giving them the DMSA, we're giving the EDTA, and the alpha-lipoic acid through controlled release. Now they're dumping. You've got to get it out of the body. So the infrared foot baths literally help you to get it out of the body so it does not stay inside. These invisible waves are literally absorbed right through the tissues, and it dumps, it vomits the toxins out of the body at every cellular level. So the FIR, which is far infrared, is the wavelength and frequency that it gets the deepest amount of detoxification in the body. So take a look at that. On one study they did on the sweat analysis, they found out this many different elements and toxic elements were eliminated in one 35-minute session. So when you're using the challenge and you're using sauna as well, you're getting rid of the thallium and uranium and copper, high levels of copper and arsenic much faster than anything I ever know. But you are going to lose some good minerals along with the heavy metals, so that's why we recommend that you evaluate and see if you need to add some Minrex or good minerals back in at the same time. Again, that's where the testing comes in, why we use hair and blood together. And the SBN report gives you a report comparing those two together. No other testing out there does that to my knowledge, certainly none I used in the past. We also use foot baths along with our challenges, and this helps to dump the toxins. Those prices are coming way down. You go to Brimhall.com, they can help you on that too. Used to pay $3,000 for a foot bath. Now they're $1,000 or below on some of the specials we run. We use pulsed electromagnetic fields as well. This is a $20,000 toy, but I have one. I get on it every day. I was in a rollover accident 3 years and a month ago. They told me I had to have surgery, but I do this coil over my back every day. I'm completely pain-free, which they told me is possible, and no surgery. Then also I use it over organs because it helps to exercise and eliminate toxins from every cell in the body. A lot of different tricks of the trade here. Another toy that we use, we teach you in our seminars, is the ASA or the LZR7. This actually evaluates sensitivities and toxic reactions in the body and helps to make a homeopathic preparation both for laser and for oral use, and also we wear little wristbands to help reprogram the body every day. So that's it, gang. We have taken you through a tremendous overview from Dr. Merkle and myself. We have talked about many different things that are available to you. Please go to Brimhall.com if you have any questions on any of this. We will, hopefully this recorded properly, we'll go ahead and add it to the puzzle piece when it comes out next week, and you will be able to download it and listen to it and replay this. Plus I will do every week we do a puzzle piece, which I give you weekly updates on the nutrition we have going on there, different structural corrections. My wife Brandy talks about the different compliance issues and ICD-10s coming out. So please don't miss that issue. It's brand new, free. We do that every week for you, and I do that as a public service to pay back the universe for my health and restoration. The first time I went to a chiropractor, I had to be carried in, and I walked out. That's been almost 40 years ago. And that changed my life, and we have dedicated our lives to changing others. I think Dr. Merkle and his lovely wife are assisting us today. I thank all of you for joining us and helping bring health and wellness to the world. Good day. God bless. Look forward to talking to you soon. Go online to brimhall.com, find out how to sign up for the Brimhall Advantage, and take advantage.
And thank you, Dr. Brimhall. I've got control again. There were just a couple questions. There's a comment about they're wanting you to design a homeopathic for titanium. They're seeing a lot of titanium, and I don't know if those are from or from implants or foods. And they also had a question about, I'll just let you answer these, far infrared saunas for women with hot flashes, and can far infrared saunas be used for children?
That's 3 questions. Can you hear me? Let's start with number 1. The problem is getting Zymogen to go ahead and manufacture more homeopathics. I will bug them about that. There are several more that I would like to do. Right now, nobody makes titanium. I definitely think it has an advantage to do that. Number 2, the infrared sauna helps to eliminate that no matter what you do, as does the laser, even if you don't have the homeopathic for it. And I take my babies in the infrared sauna. There's no problem. I use foot baths on my baby. I actually put the array right in the bathtub when they're and help to detoxify them. And I mean, Brandy and I probably live as close as a good, healthy life as you can. We buy organic food, and we exercise daily. We have our own exercise gym down below. And when we checked our babies when they were born, they already had heavy metals and toxins in them and emotions that showed up when we evaluated them. It's pretty scary. No matter how clean you try to live, like Dr. Merkle takes his DMSA every week, I take my Chelation every day, and my homeopathic metals, I check and see what my body wants me to work on every day. So yes, babies can use the infrared sauna. I will try to see if we can get some titanium and other things, but I can't promise they'll do that for me. What was the 3rd question, Doc?
That was far infrared for hot flashes.
Oh, okay. Well, you're going to get more hot flashes in the far infrared, but it depends. What's the DC? What's the doctor of cause of that patient? If it's a hormonal imbalance due to heavy metals, then of course, as you get rid of the heavy metals out through infrared and DMSA and the homeopathics and Chelation, yes, it's going to help it. If it's caused by a hormonal imbalance unrelated to toxins, it's probably not going to help it. But we have max female for that, or max male for an andropause for a man. But most of the time, there's these bisphenols that we talked about, all these other toxic metals that are causing the hot flashes. Also, I would do a hair analysis on them and a blood study, find out what we need to do, balance them out nutritionally with. And most of the time, you're going to find an estrogen-progesterone imbalance. Most people have excess estrogen or the wrong kinds of estrogen and in later life. And so if you can give them progesterone cream, and Zymogen has some really good topicals for that, but through testing, you'll be able to determine that. Sometimes we use salivary testing. We use Labrix, L-A-B-R-I-X labs for that. And that helps us to understand the estrogen progesterone level. I know Dr. Merkle mainly depends on what the hair and the blood shows him, and he gets good results by giving proper nutrition for that.
Well, that's all the questions. That's all the questions we had, Dr. Brimhall. But I do want to let you know, I got a PMF machine after being at your lecture a couple of weeks ago, and we used put some of our worst cases on it. We had some absolutely dramatic results with that. So I want to thank you for providing these some of these things. We all get comfortable with what we do, but it's always nice you bring new things to us that we can learn from. So thank you very much, Dr. Brimhall, and thank you all everybody out there for taking this time. And enjoy the night, and we hope to have another webinar shortly. Thank you, Dr. Brimhall.
Sure do that. Yeah, and be sure and go to brimhall.com if you have any questions about any of the products we've talked about. We have write-ups on there, and, of course, you can reach me at any time. I don't hide. Thank you, Dr. Merkle. Bye-bye.
Thank you. Bye.